Well, I'm about to get inside the Texas Bariatric Specialist, where Dr. Patel and his life-changing crew are truly making a difference. It's very apparent that you have a passion to give people back their life.
But I don't think that there's any other operation that a surgeon can do that provides the different benefits that weight loss surgery provides. It has two of the greatest characteristics for surgery in general, I think. One, it gives you back quantity of life, but number two, it gives you back quality of life.
Who exactly is a candidate for this surgery?
You know, there's two ways of looking at weight loss surgery. One would be just from a pure doctor standpoint, and there's well-set criteria by insurance companies and national standards as far as who can have weight loss surgery. And the two biggest things we look at is what your body mass index is and what kind of medications you take.
You have quite an impressive establishment here with your premier pain consultants. But what exactly is pain management?
It's officially recognized. So technically it was started from anesthesiology with some diagnostic procedures, some block to help surgeon to establish, and then more and more anesthesiology community realizes they can add some value in people's quality of life and help primary care and surgeon to manage this challenge in patients, and they develop fellowship training for people to specialize in pain medicine field. And technically, you kind of position yourself between primary care, helping them, and working very closely with a surgeon to helping them to screen the patient and take care of the patient before the surgery or after the surgery, or just help patient with day-to-day needs.
So you are capable of doing minor surgery if necessary?
Yes, sometimes we perform minor surgery, and by implanting the small electrical device which helps to control the pain. It's like pacemaker for the heart. The same companies produce pacemaker for the pain. And we perform the trial, and if the patient benefits from this technology, we implant these devices, and instead of taking pills, patients have a little bit remote control and pacemaker in their body, which controlling their pain.
Wonderful. Thank you, doctor. Here at Contour Lace, they're known for contouring the body you've always dreamed of. I would like for you to tell us a little about your fantastic establishment here, the Contour Lace Body Institute. I want to know how long you've been practicing and how you got into the practice of keeping us beautiful.
Plastic surgery was definitely one of the things I was interested in, and I started off in a plastic surgery training program in Mount Sinai Hospital in New York, but I switched during the course of that to vascular surgery, and that was my passion for over 30 years, and I went on to become board certified, do my fellowship at the University of Washington in Seattle, and I was stationed here in San Antonio as assistant chief of vascular surgery at Wilford Hall Hospital. And this was during the Vietnam War, and we would get all the referrals from all over the world, people who had vascular injuries. And so it's a tremendous experience for me. And my wife and I and our children fell in love with San Antonio, and we've been here ever since, and that was 1972. My wife stimulated my interest in vein problems and trying to find ways of making those problems better without the horrendous surgical options that we used to have, and that stimulated me to look for ways of doing things without going to the hospital.
Tell me a little about, for awake, the liposuction. You all do something called awake liposuction.
Right. Dermatologists and gynecologists really have led the way to the modern era of liposuction, and basically using a technique of anesthesia called tumescent anesthesia, which was developed by a dermatologist named Jeffrey Klein. You can do this without putting the patient to sleep, and that makes a tremendous difference because the mortality, and it was a significant mortality associated with liposuction, and the morbidity, which is the complications associated with liposuction, are nearly eliminated when you do it awake.
This is where we do the famous Zorona.
Oh, yeah. Everybody's dream come true, finally.
Exactly. We're so excited to have this medical device As Dr. Mazurski said, this is a laser technology, and it's photochemical, so you just don't feel anything. You lay on there, front and back, for 20 minutes on each side, and our lovely patient coordinator, Melinda, will set it over you. And really, once you're done with the treatment, just like the Volumilift, you go back to work. It is completely non-invasive, and our patients so far have been loving it, and they've experienced wonderful results.
Fantastic.